good morning, or afternoon, depending on where you are in the world you are watching from. My name is Horatio and I've been asked to go over a few points about the health inequities of Aboriginal and Torres Strait Islanders in Australia. It's probably a good idea to start by looking at the nature and extent of inequities that these people suffer. There is a significant difference between the life expectancy of Indigenous and non-Indigenous life expectancy. Currently, Indigenous life expectancy is 17 years less than non-Indigenous populations. Significantly, mortality rates and infant mortality rates are 3 times higher than for the general population. Death rates for people of an ATSI background are higher for every specific major cause of death. The leading causes of death for Indigenous Australians are circulatory diseases, cancer, diabetes, and respiratory diseases such as asthma. Statistics on the leading causes of death show a large divide between Indigenous and non-Indigenous Australians. Did you know, Indigenous Australians are 5 times more likely to die from heart attack, twice as likely to die from cancer, 18 times more likely to die from diabetes, 5.7 times more likely to die from cervical cancer, 4.2 times more likely to die from kidney diseases, and 3.3 times more likely from digestive diseases? It's a sad state of play that Indigenous Australians continue to experience lower health status than other Australians due to higher levels of disability and reduced quality of life. Not only that, but they are hospitalized at 5 times the rate on non-Indigenous Australians. There are many reasons that contribute to the inequities that are suffered by the Indigenous populations in Australia. These can be classified as socio-cultural, socio-economic, and environmental determinants. Let's look at these individually, shall we? In Indigenous populations, a communal approach to family and parenting, the remoteness of some communities, incompatibility with many aspects of Australia's political, legal, and educational systems, and lack of role models in some areas of society have been identified as social determinants that contribute to health inequities. On the whole, Indigenous populations have lower incomes than the rest of the population. In fact, the median income for Indigenous people in 2006 was 55 of the median households, and have higher rates of unemployment than other Australians, and also have lower rates of education. Only 36% of 18-24-year-olds and 9 of people 55 years and over. These factors make it difficult for them to have the same health status of other Australians. As far as the environment that they live in, housing standards are a priority issue. They require better water supplies for their populations, training for Indigenous environmental officers, improved transport, communication, and better health and safety relating to dogs in remote communities. Oops, excuse me. Anyway, it raises the question, what role can an individual, community, or government play in improving the health of Indigenous populations? Let's look at these individually. Well, any individual has the power to reduce their risky behavior, increase their protective behaviors, or promote good health to others. However, the individual's capacity to these things can be negatively or positively by their age, family history, the role models they've got or had, their education, the community support available to them, their access to services, and their socio-economic status. Different individuals and their circumstances, but ultimately it is education and access to services that will have the biggest impact on health. The community can also play a major role. Unfortunately, Indigenous Australians don't access healthcare services to the extent that they should because of a lack of service available, a lack of transport combined with the distance to services, cost, and language barriers. Most community agencies aim to improve the access of Indigenous people to primary healthcare services. These agencies base their strategies on the principle of working in partnership with Aboriginals and Torres Strait Islanders community-controlled health sector. The responsibility for producing Aboriginal health solutions lies with local Indigenous people working in their own communities and using their own philosophies to promote healthy behaviors and deliver culturally appropriate primary healthcare services. In a political sphere, governments are working closely with Aboriginal and Torres Strait Islander populations to address health issues for this group. The Australian government has committed to closing the gap between Indigenous and non-Indigenous health by ensuring their full participation in addressing their health needs. Funding is also provided in the Statement of Intent for specific quit smoking programs. Other strategies include the provision of specific health services for Indigenous populations that are initiated, controlled, and operated by their community. Sorry, that's my phone. I've got to take this call. I hope you found this useful. I know I've had a frothing good time. Until next time, au revoir and good night.